Hi guys, it's Dr. Rich from Salvatore Dental. Today we're going to talk about dental implants and going over a few things about, what are they, how do they work, and what are the benefits of dental implants. So I'm very excited to show you what we have. So a lot of people come in and ask, what are dental implants and how do they work? So the dental implant procedure is a procedure where we can actually have a missing tooth that is permanently replaced. Some of the past methods for replacing teeth would be like a denture or something that comes in and out, or having to do a bridge where we'd have to whittle down a tooth in front of the missing tooth and a tooth behind the missing tooth. Now with dental implants, we can have a nice strong tooth that's on a titanium base. So the foundation now is made out of titanium and a permanent tooth on the top. In this case, the missing tooth doesn't come in and out, and it functions very similar to a natural tooth. So a natural tooth has a root, kind of like a tree has roots, and the natural tooth, when it's lost, the root is gone. But what's left is bone. So an implant is a titanium root, so that instead of a tooth root, we have a little titanium screw that goes in the bone. And then for some reason, titanium and bone really like each other. So the bone and the titanium over time will actually link together, bond together. The word is integrate, and integrates together. And now we've got a nice solid foundation that we can put a permanent tooth or permanent restoration. Imagine having a tooth that looks exactly like your real tooth, but underneath, instead of having a root, you actually have a titanium metal implant base. The great thing about implants are they're very long lasting. If well taken care of, they could be indefinite, and that's what we shoot for here at Salvatore Dental, making sure that we're staying up with your hygiene and taking care of it here and at home. And the process itself, the dental implant process, is actually very streamlined and efficient. Most of our patients, when it's just a single or a double implant, you're here for maybe an hour. We chat a little bit, we take some time for numbing, and then once we're ready, it only takes about 20 minutes to have the implants placed. So a very short time in the chair. Afterwards, pretty easy healing, and then the nice thing is you have a tooth that's a permanent restoration. We often get asked, who's a good candidate for dental implants? The good news is that most people are great candidates for dental implants. If you're missing a tooth, you're missing many teeth, you've got teeth that have a really poor condition with gum disease and teeth are loose or starting to fall out, you most likely be a great candidate. The only people who don't qualify for dental implants is sometimes based on age, meaning you want to make sure the patient is fully matured before they have a dental implant. So if we have teenagers or people that are in their early 20s, the issue is we do have to wait till they're a little bit older before we put in the permanent implant. So in that age range, you're not really a candidate yet. The reason being, as you're growing, teeth and the mouth is shifting, the implant eventually won't be in the right position. So a lot of patients that come in who are going through braces, orthodontics, they're missing a couple of teeth, and they come in very ecstatic and ready. They're teenagers, they're ready to get their permanent teeth. At that point, we have to find some kind of solution until they're a little bit older so we can have a permanent tooth. Who else would qualify for dental implants? Most people, but people who don't qualify for dental implants could be people who have uncontrolled diabetes. They might be smokers, some previous radiation treatment, or on some medication called bisphosphonates. So there's a few things that we really have to cover in going over your medical history, making sure that your body is healthy enough for you to heal around the implant. And a lot of times we are surprised at a little tweak here and there. We sometimes see your MD first, and then we can get the diabetes under control. We can do some hopefully smoking cessation where we stop smoking, and then we're a great candidate for dental implants. The only other people that might not be candidates for dental implant are people who just don't have enough bone for implants. This used to be a very big issue, but thankfully now we have different techniques where we can place implants where patients before didn't have enough bone and were not candidates. So I always stress my patients, even if you were here 5 years ago, here I'm trained on new techniques where thankfully we can have implants placed where there's not much bone. In the past, you were not a candidate. We have techniques here. It's not everywhere. We do special implants. They're called zygoma implants or cheekbone implants. They sound scary, but they work great. And we have other techniques to really make sure that you can have implants even though you think you might not be a candidate and you might not qualify. A lot of patients ask, what's the difference between a mini implant and a regular implant? The pros and cons of a regular dental implant to a mini implant. A mini implant sounds great for marketing. They're marketed as cheaper, faster, and easier. But that's unfortunately just, in my eyes, kind of a marketing ploy. They are cheaper because they're a one-piece unit, but they're smaller and they're not as stable. They are faster because you literally just screw it in and that's it. And they are supposed to be easier because there's less numbing. You don't have to do this thing called a surgical flap where you open the tissue up. And although this sounds good and all those things sound scary, you don't want to have them done, it does really compromise care. The pros of a mini implant is just that it's easier marketing and it kind of brings patients in the doors. There are some practices that kind of say, here's our cheap, easy mini implant option, you get you in the door, and then when you're here, we say, you know what, we really need a regular dental implant. So here at Salvatore Dental, we kind of skip over the mini implant. We go right to the full regular implant. So a regular implant compared to a mini implant is just a very robust restoration. So a mini implant is literally less than 3 millimeters. So it's usually about 1.8 millimeters, which is very skinny. And that's the whole foundation. You have this very skinny mini implant. And then on the end, you have this big crown. So the way that I tell patients, imagine a stick with a ball. And a stick with a ball in your mouth wouldn't be great for a few reasons. One, it's going to be kind of unstable, but two, whenever you're chewing, you're going to have some spots underneath where you really can get food and debris stuck. A regular dental implant, full body dental implant, is 3 millimeters or more. Oftentimes 4 or 5 millimeters is where we have a nice implant, because that's very similar to our teeth. Now you've got a nice strong implant that's placed, that's a foundation. And what I like is that now instead of a stick with a ball, you have something that's more formed like a regular tooth, where the root and the tooth are a much more consistent size. And now when you're chewing and eating, you don't have a spot where you get food stuck. So a huge problem we see with mini implants when they are stable is that there's still a nuisance with getting food and debris stuck. So I really would stress sticking with a regular dental implant, staying away from mini implants. Here at Salvatore Dental, we have ways of financing if it's a financial thing, and I'd love to go over any options with any of my patients or soon-to-be patients. Patients wonder, what is the process for the dental implant from start to finish? It's a great question. Here we've got a very streamlined process where we start with a very comprehensive exam, including a 3D x-ray. So the first thing we want to check with implants is doing not just a normal x-ray. A normal x-ray is 2 dimensions, meaning we're 3D people, and a normal x-ray, everything's kind of pancaked down and you can't really see the whole view of the mouth. With implants, what's important is the location of the bone, but also the width of the bone. So you have special imaging here, a 3D x-ray, it goes around your head, and then I can see your jaw in 3 dimensions. And that's where the planning takes place. We go over a thorough medical history, I look at your 3D scan, and then we can plan exactly where the implants should be, what type of implants, how many implants are needed. So your first step with us here is a comprehensive exam with a 3D x-ray. At that point, we come up with a treatment plan. The treatment plan, will, of course, will tell exactly what teeth we're going to replace. It has the time and the money involved. After we're ready to move forward with the process, here at Salvatore Dental, we do things guided. So the next step we do is do a scan in your mouth. So we take an impression, but it's not the old school impressions with alginate where you go in and it's this big tray and everything's hanging off it, and we put it in there and it's in your mouth for 5 minutes and you're gagging. It's a much better process now. We've got a scanner, you open your mouth, we got literally a camera that goes in for about a minute, scans everything, and now I've got 3D imaging of your gum and your teeth on my computer. The next step, I go back on my computer, I merge the 3D x-ray and I merge that also with that scan that I took. And now on my software, I can place exactly where the implants are going to be, and with a few clicks, I can make something called a guide. So a guide does exactly what it's called. It guides the whole process. I create a guide on my computer, I send it over to one of our many 3D printing machines, and I 3D print out the guide. So now when the surgery is ready to happen, it's not just kind of figuring it out on the fly. It's a fully guided process where now the guide slips on the adjacent teeth in your mouth, depending on what kind of guide we have and how many teeth. And then the whole process is controlled. It's all computer driven. So you're not relying on, multiple variables here. We know exactly where we're starting and where we're finishing. When you're in the chair, you get a little bit numb. We go over the consent. And then most of our patients are just numb and we don't really need any sedation. We do have some sedation options, which of course we'll go over with our patients. But most of the time, we get numb, guide goes on, implant goes in, and that's pretty much it. That's the first step. First step is quick. We schedule about an hour or less for our dental implant placement procedure. The next step for a normal implant would be about 3 months of waiting or healing. So the one thing that we have to do with dental implants is if we're doing a single or double implant, regular tooth implant, we can't put the crown or the chewing tooth on it right away. What we have to do is let the implant sit underneath the bone and let things heal. So after the implant placement, you're healing for about 3 months. So for about 3 months, you got an implant placed under the gum tissue, it's doing its thing. Over time, it's bonding with the bone. And then after 3 months, you come back, we do another scan. That scan will show us if you're ready to be restored. And then your next step, you would come in, we'd uncover the implant, and then we impression, and then the last step is you get the crown. So many patients ask, how long do dental implants last? So dental implants definitely are an investment. It's not an inexpensive procedure because you're getting a really, really good quality product. You're getting a tooth or multiple teeth, all of your teeth that stay in and they're fully functional. The lifetime of an implant, as long as it's well taken care of, should be indefinite. As long as you're having your proper maintenance, coming in for your cleanings twice a year, 3 times a year, however it may be. It's the same kind of thing with implants. So think about implants just like teeth. You want to keep good care of your teeth at home, brushing and flossing, and going to the dentist. Do the same thing with your implants. So as long as you're staying with the dentist and the hygienist and we're getting your checkup x-rays, if there's anything that's kind of starts to look funny, then of course we could go in and repair just like a tooth. So I always tell my patients that the lifetime of a quality implant should be indefinite. Just take care of it like you take care of your own teeth. So if you guys would like any information about implants, or you think you might need an implant, or you just like to meet us, please reach out. We're here at Salvatore Dental. Our phone number is 518-899-6068. Thank you so much.